Good afternoon. Thank you for joining us. BC Seniors Advocate says more people who need to move into a long-term care home are waiting much longer, and their families are feeling burnt out. How is that gap affecting you and your family? And what about alternatives? Are enough of those available to you? Dan Levitt will take your calls. Plus, auto manufacturers are among those waiting as Canada tries to sign a new trade deal. What does the current car market look like for you? Are you considering buying or selling a vehicle? AutoTrader.ca will join us after 12:30. I'm Michelle Elliott. Welcome to BC Today. First, let's give you a brief update on the wildfire situation in BC. There are 62 active wildfires in the province, including 4 that have started in the last 24 hours, with 1 active evacuation order and 2 evacuation alerts. You may have heard an out-of-control wildfire burning near Lytton has triggered evacuation alerts in the area. The Thompson-Nicola Regional District says the Cantilever fire led to alerts for at least 5 properties in the Spencer Road South area. The BC Wildfire Service says the fire discovered on Monday has grown to 1.5 square kilometers. It is suspected to be human-caused. Kelly Green is BC's Minister of Emergency Management.
Currently in BC, there is 1 evacuation order in place for the Fort Nelson First Nation, with 2 active evacuation alerts in the Thompson-Nicola Regional District and the Lytton First Nation. I want to acknowledge how distressing it must be for the people in the Lytton area with a fire that started outside of the village yesterday. We have good communications with the First Nation and local government, and crews are working hard to respond to the fire. While we have been fortunate to have some cooler weather lately, warming summer temperatures and ongoing drought means that much of BC is at heightened risk for wildfires. Now is the time to take action and put a plan in place before there is an emergency. As we make plans for the long weekend, I encourage everyone to take some time to make a household emergency plan. Have a grab-and-go bag ready for every member of your family, including your pet. Make sure to include essentials like ready-to-eat food, drinking water, clothing, important documents, cash, and a copy of your emergency plan.
Now, despite a calmer summer, we are heading for a scorcher week with above seasonal temperatures. Add to that the risk of dry lightning, and BC Wildfire says it increases the possibility of new fires. BC Minister of Forest Ravi Parmar says he acknowledges uncertainty felt by communities in and around Lytton. He's urging British Columbians to take caution for the rest of the wildfire season.
As Minister Green acknowledged, the community of Lytton, the Lytton First Nations, and those surrounding regions have faced a lot over the past number of years. On behalf of all of us, our thoughts go out to those that continue to live in uncertainty, but I'm really thankful for the leadership provided by the Mayor of Lytton, by the Chief of the First Nations, as well as all those, including the Regional District, who will continue to step up, work alongside the BC Wildfire Service, EMCR, to be able to support communities. Recognize that it's a very challenging time and a lot of uncertainty for those folks living and impacted by that fire. In total, there have been 623 wildfires started this year, in comparison to 1,059 at this time last year and 1,522 this time in 2023. While many parts of BC have been fortunate so far with fewer fires and less devastation, we know that this can change in an instant. Right now, 98.5% of the hectares burned have been in the Prince George Fire Centre, primarily in northeastern British Columbia. In the rest of the province, we're seeing a season that's quieter than usual, but let me be clear. Don't let that lull into a false sense of security.
That's BC's Minister of Forest, Ravi Parmar. Now, in much of the province's interior, residents are being advised to prepare for a heat wave over the coming days. Environment Canada has issued heat warnings for much of the region. It's also warning the higher temperatures could stick around until Thursday. Meteorologists say temperatures could reach up to 8 degrees above normal in some areas. It's 12:10 now. You're with BC Today. In other news, the federal government announced it will cut ferry fares in half in eastern Canada starting next month. But the BC government is calling on the feds to also turn its attention here to BC ferry users. Premier David Eby is asking for an increase in ferry subsidies, saying ferry users in the Maritimes get $300 per person, while BC gets just $1 per person. BC's Jobs Minister Ravi Kahlon says the issue of federal funding disparities goes beyond just ferries.
This is a long-standing issue that we've had with the federal government, and it's constantly reminding them that there is more to Canada than the Rocky Mountains. And often what we find is decisions are made on Eastern Canada, in this case, to, I believe, expand trade, interprovincial trade, create opportunities for the economies out there. Well, that's important here as well. You know, the communities on the islands, and I was born and raised on the island, I can tell you depend on it. That's the highway for them. And that trade of goods is vitally important. And this is not only in shipbuilding. We've seen this consistently when it comes to building infrastructure as well. There's a lot of bridges and tunnels that get funded in the East Coast. We've had 3 elections of the same announcement of funding the the Massey Tunnel crossing, and yet we haven't seen the funding that we have been told is coming. And so I'm hoping that changes. Certainly, we're more hopeful. We've seen some good indications from the new Prime Minister, but they must have known when they were going to make that announcement on the East Coast that this concern would come to them from the West, but there was no announcement for dollars at the same time.
$12.12 now. You're with BC Today. Well, BC's Seniors Advocate says more people are waiting, and they're waiting much longer to get into a long-term care home. He also says it's only going to get worse. Dan Levitt just released a review of the system this morning, and he says the province's current plan isn't enough to address the shortfall in long-term care, and that as seniors wait longer, family caregivers are financially drained and burning out. Dan Levitt says there needs to be more alternatives like home support or respite care. He'll join us, and we are taking your calls as well. How is the gap in long-term care affecting you and your family? And how are you finding alternatives like home support or respite care? You can call us 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. Email is bctoday@cbc.ca, or just comment on our TikTok Live. And Dan Levitt joins me now. Good afternoon. Thanks so much for being with us.
Good afternoon. Great to be here.
So where everyone is clear as they're listening and watching, when we say long-term care, what kind of facility and what kind of home are we talking about?
So we're talking about usually seniors who require a 24/7 nursing professional care. These are people who can't transfer usually from their bed to the bathroom, or they're not mobile. They might require a wheelchair. These are people often who are incontinent as a result of an advanced dementia. And usually people are living in long-term care for a couple of years. These places often feel and resemble more like a hospital style, but it's a lower level of hospital care, if you will. And usually people move into long-term care after many years of experiencing the journey of dementia or other chronic conditions that unfortunately accompany older ages.
And how has the need for these long-term care facilities grown versus the supply that's available right now?
Well, unfortunately, we haven't invested enough in seniors. And seniors care is one of those areas, and particularly long-term care is probably the canary in the coal mine, where we haven't seen the kind of investments that's needed to ensure that the wait list, the time people are waiting and the number of people on the wait list declines. We've seen the number of people on the wait list actually increase over the past decade by 200%. And the amount of time people are waiting over that decade has also doubled. So people used to wait 10 years ago for 5 months. Now they're waiting 10 months because we have not invested enough in building the infrastructure that's needed in the communities where seniors live.
And during that 10 months, those 10 months, what's happening there? What's available? What impact does that wait have on the senior and their family?
Yeah, so the average is 10 months. Some people are getting in sooner. Some people are waiting
Sure.
years at a time. And they're relying on family caregivers, and that's something that we do. We help out each other. So if you have a spouse or if you have a child who's supporting you, you might end up waiting longer. Meanwhile, things like adult day programs, which essentially is during the workday long-term care, where you go in the morning, you come back in the afternoon, or things like respite care, which is overnight care. We haven't invested enough in those supports that are community-based, nor have we invested enough in home care because often people are paying a co-payment that's not affordable and pushes them to the brink where they're deciding what to go without because they can't afford it.
What does that mean then for the senior and their families? What is life like?
Well, I think it's incredibly stressful. If any of your listeners have gone through this themselves, or they know someone who's gone through it, the reality is that if you live long enough, you likely will need long-term care or know someone close to you who needs long-term care. 1 in 3 British Columbians over 85 will either be living in assisted living or long-term care or be receiving that care at home. The other third of people over 85 are supporting that person. So really 2/3 of people over the age of 85 will be experiencing this, and it will impact everyone because people who are in the workforce are supporting that person. If they're not in long-term care, they're going into hospitals or they're using doctor's offices or the ambulance, and it affects the entire economy, and it affects and strains also our healthcare system.
We are hearing from people experiencing this right now on the open line. You can give us a call now. How is the gap in long-term care affecting you and your family? And how are you finding those alternatives? Are you seeking them? Are they available? Home support, respite care, day programs. Our numbers are 1-800-825-5950, 604-669-3733. And you can hit pound 690 on your phone or email bctoday@cbc.ca. You can comment on our TikTok live as well. My guest is BC Seniors Advocate Dan Levitt. And Tanya is on the line in Port Coquitlam. Hi, Tanya. How is this gap affecting you? Hi, Tanya. Are you there?
Hear me?
Yes, we can hear you now. Go ahead. Thanks for calling in.
Hi. I have a 94-year-old mother who has heart failure. She lives in independent living. She has dementia. She can barely walk, and we applied through our doctor to have her put into long-term care, and Fraser Health came out. They told us that they could provide somebody for $30 an hour who would not help her dress, would not help her make her bed, would not help her wash, would not help her change her colostomy. Essentially, they were just there to phone 911.
This is for home care.
This is for home care in the long-term, in independent living.
Right.
So my sister and I have to do the work. She told us it would be at least 2 years before she could go into long-term care. She did not offer anything else.
What does this mean for your mother and for you and your sister?
It means that we take care of her all the time, or she is on her own. The person that runs the independent living says that she is an intolerable risk to herself and others. We can only do what we do, and it's extremely tiring. We're both anxious, both my sister and I, and we don't know what to do. So when I turned on the TV and I heard you were going to have Dan Elliott, I wanted to speak up.
Anything you want to say to Dan Levitt, Tanya, while we have you on the line?
Sorry, Dan Levitt.
Sure.
No, I just wanted to say what I just said.
Okay. Yeah, that's certainly, I think, reflective of what I saw in the report today released by Dan Levitt. Thank you very much for your call, Tanya. Yes, go ahead, Dan. She really wanted to make sure that that message got to you.
Yeah, well, Tanya, thank you for sharing your story, and thank you for supporting your mother and as well as your sister. It's encouraging to hear that in independent living, supports can be brought in, but it sounds to me like the supports that are offered are inadequate for what your mother truly needs, and the burden is being placed on you. When we did our report, and we heard from 900 caregivers, people like yourself, They told us their stories, and they're really heartbreaking because essentially what government's doing is instead of building enough long-term care, the pressure is being shifted, and financial pressure also being shifted onto the family caregivers. And ultimately, your mother's a good example. If she's at intolerable risk, she really should be in long-term care where she'd be getting 3.36 hours of direct care. So if you're not in long-term care getting that, you really need that wherever you're living. And Tanya, what I might encourage you to do is call my office, the Office of the Seniors Advocate. Our number is 1-877-952-3181. That's 877-952-3181. We operate an information referral line, and we have people who will answer your phone call and will give you some information and perhaps help you on that journey to find the kind of care that your mom rightly deserves.
Yeah, Tanya, thanks so much for calling. Dan, it's not exactly a surprise that demand has grown, right? We've known that we have this aging population. We're seeing it now. Why hasn't the province done enough to meet that demand over this last decade?
Well, you're right. We've known about this since the 1950s when the baby boomers, that bulge, if you will, a 20-year demographic is moving through and becoming now in older age. The oldest baby boomer today is 79, and she'll be 90 in 11 years when we need 16,000 more beds. We essentially have to increase our bed stock by 50% in the next decade to ensure that people like Tanya's story isn't heard more frequently in British Columbia. So why haven't we done this? Successive governments have done something around long-term care, but there was a period of time where we didn't build long-term care. And you look at the alternatives that are there. One of them that was introduced 25 years ago was publicly funded assisted living. And last year, there were 1,200 people waiting for that service as well. So the general continuum of subsidized seniors care in BC has not been invested in the way that's needed to hit the demand that's coming with the baby boomers and those who follow them. We have to invest now. We've got to have a plan immediately so we can ensure that 10 years from now, we don't have more stories like Tanya's situation.
Tanya, thank you again. Denise is our next caller in Mission. Hi, Denise. Welcome. What did you want to say?
Hi. Thank you. First of all, I'd like to thank Dan Levitt for bringing attention to this matter. Our family is desperate. Our sister-in-law is in a nursing home. She has progressive supranuclear palsy. It's a type of Parkinson's. She's 72 years old, in a wheelchair, cannot walk. She falls every other day, and we're really, really concerned. So we couldn't even get her in subsidized care. Right now, she's in a private home that costs $9,200 a month. And she is out of money. And so we said to Fraser Healthcare, what happens when she's out of money? Well, that's up to the family then. So what are we meant to do? This is ridiculous.
Not more than $9,000 a month is the cost.
Why can't they subsidize the $9,200 a month if they haven't already got the homes?
Okay, so you've turned to private care for your sister-in-law, but it's the cost.
We had to.
Yeah.
Yeah, we had to.
Denise, thank you very much. Dan, I know you talk about the financial strain as well as, and does that happen more frequently because of that, the gap, and people are turning to private operators?
Yeah, absolutely. There are more private operators and more beds being built. For example, one company is building 1,000 beds approximately on the west side of Vancouver, and people are paying out of pocket. This is not subsidized. Could it be subsidized? Absolutely, it could be, which would give some break to Denise and her family. Certainly, $9,200 isn't out of range in terms of the actual operating cost. Publicly subsidized long-term care homes are around $8,000 to operate, some a little bit more than that. So $9,200 is probably about the operational cost for a long-term care bed. If it was publicly subsidized, the highest amount British Columbians are paying is just over $4,000 a month. So when you think about that we're paying ourselves and that the rest of it's paid by government, and we're not building enough, that there is something there to consider. But the infrastructure really has to be built. And I would also encourage Denise to call our office if we can see if we can help guide you a little bit on your journey as you go forward.
Again, that number is 1-877-952-3181. 1-877-952-3181. That's the number for the Office of the Seniors Advocate. 1-877-952-3181. The number Dan Levitt just gave. If you'd like to call us, our number is 1-800-825-5950, 604-669-3733. Denise, thank you. Let's go to the Interior now. And Penny is on the line to talk about the gap in long-term care services. Hi, Penny.
Hello.
Hi. Go ahead.
Hi there. I just wanted to let you know, I've run the whole gamut. I worked as a care aide for 8 years in the Interior. My mom moved in with us 3.5 years ago. She just got placed in a home in October. So I've literally done it all.
Yeah.
I've had to live with the lack of home support for 3.5 years, to the point that we did not get respite. Out of a month, we were lucky if we seen someone for 10 days, like 10 visits in a month, and then everything would be great. The nurses in where we are in Interior Health, that they basically said that the system's broken, and I kind of looked at them and said, so what are you doing to fix it? Like there's a lot of things that are happening that shouldn't be happening. One, people don't get paid enough to do the job. Like literally, I worked night shift. I took care of 75 residents with myself and a nurse, and I got paid $20.91 an hour. My daughter works in daycare. She makes $27 an hour. And we're talking the same area.
Yeah. So you're saying that's behind it as well, behind the gap, the lack of home support that you're seeing.
It's hugely behind the gap because honestly, it's not an easy job. It's not for the faint at heart. You have to be caring. You have to be understanding.
Sure, absolutely.
You can't just do it for the money. You have to do it because you like older people.
Yeah.
And we literally, these people don't get paid what they're worth. Like it's not a living wage. Like I worked Interior Health Home Support, and I was absolutely flabbergasted at how poorly it was run.
Penny, that really good to hear from you, and that perspective, having worked in the system as a care aide as well as someone who is taking care of your mom now. Dan, we're going to take a quick break for the news here, but let me just also look to the future. I know in your report, you're thinking about what do we do now and how do we plan for the future? You know, what's something that what are the steps that need to be taken right now?
Well, immediately, our first recommendation is that the government roll out their expansion plan for long-term care beyond the next 5 years, and we want to see it for a decade ahead, and we want to see the gap being controlled so that people aren't waiting longer and we don't hear more stories like Penny's and her families, so that people get timely access to long-term care in the communities where they live. And I think it's even more relevant in rural and remote BC, especially in places like the interior.
My guest is Dan Levitt, BC Seniors Advocate, who just released a review of long-term care services this morning. And we have been asking you for your experience. What impact is the gap as more people wait and for longer, an average of 10 months to get into a long-term care facility? What impact is that having on you or your family? We're going to take more of your calls coming up in our next half hour. As well, we are going to talk about car sales, which have been affected. We're seeing an impact from the trade war, from the tariffs, and when it comes to the United States. And we'll talk about that. If you're on the market for a new or a used vehicle, what are the prices that you're seeing? Is now a good time to look at a used car or to sell a used car? So we're going to talk about that with AutoTrader.ca as well in about 10 minutes from now. But we're going to go to Sandy in Kelowna to talk about long-term care further, along with Dan Levitt. And that is just right after the CBC News Update. And here's Rob Zimmerman.
Good afternoon. Homicide investigators have taken over the case of the suspicious death of a nursing home patient in Abbotsford. Police say the case began when two patients at Menno Home were transferred to hospital for medical emergencies thought to be suspicious. on July 6th. Investigators say one of the patients died 4 days later. RCMP are confirming one person was killed in a house fire along Calview Drive in Coldstream last Thursday. Police say the person was trapped in the home and human remains were found in the rubble. The victim has been identified and family has been notified. And as we've been hearing on the show, BC Seniors Advocate says the province has a current shortfall of more than 2,000 beds in long-term care and will need many more to meet future demand. Dan Levitt says in a report that BC will need almost 16,000 new beds by 2036 as residents in the province age. The report says the number of people waiting for beds has grown to more than 7,000 this year, and current provincial plans will mean wait times could become untenable. And now the forecast. Heat warnings continue for many sections of the province with highs in the mid-30s. On the north coast, mainly cloudy this afternoon with a high of 19. Highs reaching 27 with a mix of sun and cloud in the Peace. In the central interior, some sunshine with a high of 30. Highs from 30 to 35 with a mix of sun and cloud in the Kootenays. In the southern interior, sunny with a high of 34. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, sunny this afternoon with highs up to 30 inland. That's your CBC News update from Vancouver.
Rob, thanks so much. It's Rob Zimmerman in the CBC Vancouver newsroom. And this is BC Today. And as you heard from Rob, BC Seniors Advocate has released a report today saying that there is a growing shortage of long-term care beds and that people are waiting much longer, and that wait to get into a long-term care home has grown significantly over the last 10 years. And Dan Levitt reports that 16,000 new beds will be needed by 2036 in order to fill that shortage. We've been asking you what impact that gap is having on you and your family, and Sandy has been waiting in Kelowna to comment. Hi, Sandy. Thanks for joining us.
Oh, hi. Thanks for taking my call.
Yeah.
So I have a personal experience. My mom was diagnosed with early dementia at the age of 74. Her husband was 10 years older than her, so he was 84 at the time. He had cancer and then been battling that. We had my mom on a wait list for 4 homes. They give you a list of homes that you would prefer to be put into for almost 2 years. And didn't get her in. And so we went to talk to Interior Health. They never came at the right times at all, ever. And as far as respite, that wasn't an option because they didn't feel that they could, help her at that time. And then I looked into private care as well, which was $45 an hour. We ended up putting her in a private facility here in Kelowna for almost $12,000 a month. I was given 2 prices initially when I signed her up or tried to get her in. And when I asked them a month later how, what was she allocated as far as, expense, and they picked the higher amount. And so my stepdad went into the hospital just after we got her in here because he was just basically taking care of her to live. And we were told by Interior Health that it was dire and extreme circumstances if we could get her into a home or a funded bed. Now, extreme and dire, my mom was a cleaner. So she would clean the toilet. Unfortunately, there was feces in the toilet all the time. And then she'd put it all over the light switches, the sinks. So I was basically caring for them on a daily basis, cleaning, bleaching, laundry.
Sandy.
And and then my stepdad passed away December 31st of 2024, and my mom passed away in the private home on in March 15th of this year. She was only in the home for 3.5 months. Yeah. So, and then the ironic part is that Interior Health called me the day she died and said that they would have a bed open for her.
Oh, my goodness. Sandy, I'm sorry for your loss. And you really obviously went through a lot in terms of the care that you had to provide. I don't need to ask you what impact that had on you. I'm sure that was quite the strain.
Yeah, it was a strain. And the money, it wasn't an option. It was just to get her a place safe because we took her into one option at one point and she was a flight risk. So because she just, so that was the other thing is if she was at the home, which are their farmers and ranchers, she would just, walk out of the house naked or pants on backwards or lipstick on her eyebrows, and then interior health was no help. And then when I asked him that, the head nurse that came to visit us a couple times, he goes, well, the only other option is if you take care of her. And I'm like, I live in a 4-level split.
Yeah.
And she can't even walk, she touches the ground to see what the texture is, because she'd fallen a couple times and she didn't want to fall. And that was his option for me.
Yeah. Sandy, the burden of that as well. Thank you very much for joining us and for sharing that. Again, I'm sorry for your loss that you've experienced. Natalie is next in Victoria. Hi, Natalie. You work in long-term care.
I do work in long-term care here in Victoria. I'm out in Souk, for a matter of fact. My concern for the island is that people that are failure to thrive in society under the age of 60 are being placed in long-term care homes over top of people that have been waiting to be in long-term care homes. We have 3 right now in our care home out in Souk that are failure to thrive, and they can walk to town and buy their wine and their cigarettes.
Okay, so because there's so much of a need. Concern. Yeah. Natalie,
there's no mental health care facilities for these people to go into, right?
Yeah.
I just want to put that in people's bonnets that are waiting for their family members to get into care facilities. Nanaimo has one whole unit that's full of failure to thrive people.
Oh. And and they're being diverted then to the long-term care facilities. Natalie, thank you very much. We're not able to go to Valerie in Westminster, but I know she wants to talk about alternatives we need to move forward, as the goal is, of course, to age in place and for seniors to be able to live at home for as long as they can. And so, Dan Levitt, what needs to be done there? It sounds here like, yes, a lot of the burden has been put on family caregivers. And so what is the support that's needed there so that seniors can stay at home and live life within the home setting rather than in a care facility?
Well, first of all, with Natalie's call, I think it's really critically important that we build long-term care in the communities where seniors live, so they don't have to leave the town where they're living. So I've visited that long-term care home. They have space there that they could build more long-term care. Really, every community in BC should have long-term care or some other alternative that would help people age in place in the communities where they live. When we think about aging in place at home, we want to make sure that this is a reality, that it's not a myth, that people can age in place. So we need much more home support, and we need to eliminate the co-payment for those who are paying that extra cost for receiving the care. Alberta and Ontario do not charge a co-payment. BC does, and is amongst the highest. We need to see more things like respite care, that overnight care that's essentially short-term, long-term care. We need to also see more adult day programs, which is long-term care during the daytime. And we need to see other things that we can do, looking at technology and looking at other supports that are available so we can help to automate things like medication administration, and looking at sensors, wearables like I'm wearing today, so that if somebody's heart rates or their vitals change, we can get them help right away. So there's a whole things we can do together to look at supporting seniors so they can age in place in the communities where they are, and also provide supports for the caregivers so that the expectation we have on them is reasonable and they can thrive at a time right now where really they're stressed out and they're burning out because we have not invested enough in seniors generally.
Dan Levitt, it's been really good to have you. Thanks so much for staying longer as well. As you know, probably more than anyone, people want to talk about this. So I appreciate your joining us. Thank you.
Anytime, my pleasure.
Dan Levitt is BC's Seniors Advocate. It's 12:40 now. You're with BC Today. Now, in other news and international news affecting Canadians, one of 4 Canadians among Hong Kong's international arrest warrants is Victor Ho, who's a former editor of the BC-based outlet Singtao Daily. Now, he's accused of participating in, quote, illegal means to overthrow and undermine China's fundamental system, end quote. NDP MP Jenny Kwan has been vocal about Hong Kong's international arrest warrants of pro-democracy advocates, and she spoke to Stephen Quinn on the early edition this morning about these latest warrants and says they're a matter of trying to repress dissent.
trying to really intimidate people, right? Just trying to send a clear message that they want people to be silenced, that you're not allowed to have an opinion. The truth of the matter is the national security law was brought in, and that stripped Hong Kongers their basic law, their rights, the various rights that was enshrined in basic law, and which, by the way, was a promise from Hong Kong to the international community. That agreement was signed in front of the world, and we all thought that the government would actually honor it. The Chinese government would honor it. But of course, as we now know, with the national security law being brought in, Hong Kongers' basic rights have all been eliminated. Basic laws do not exist. Hong Kong used to have a process of electing councillors, at least some of them anyway, but now that's been done away with. And so this is what people are particularly concerned about. The national security laws are draconian, and they're trying to apply these laws not only to Hong Kongers, to people in China or Hong Kong, but also people in the international community.
It's 12:42 now. You're with BC Today, and we are just days away from Canada's August 1st trade deal deadline with the United States. And today, some big news about the impact of ongoing tariffs on the automaker Stellantis. Now, the auto manufacturer operates plants in Ontario. It's reporting a $2.6 billion U.S. loss for the first half of the year. And CBC's Scott Peterson explained today's news.
This is a big one. A lot of people are watching Stellantis. They are really taking the brunt of that 25% tariff directed at Canadian and Mexican car manufacturers. And 40% of the 1.2 million vehicles they sold in the U.S. last year are manufactured in either Canada or Mexico. And this is why this is a real bellwether company to look at when they come out with an earnings problem like this $2.6 billion loss in the first half of the year. Now, also the company warns of a $1.7 billion U.S. hit because of the tariffs all by themselves. And part of the reason was declining sales as well. They got rid of an old CEO that was responsible, or they say, for a lot of this decline. So there's a new CEO trying to change that around. But nonetheless, we're seeing Stellantis, which is formerly Chrysler, the make of Jeeps, Rams, and Fiats. They are the number 4 manufacturer in the world. They employ about 9,000 people here in Canada. And this is why this is such a worry for a lot of Canadians, plus a lot of thousands of secondary industry workers as well.
Okay, so what does the trade war and the tariffs, what do they mean for vehicle sales here in BC? And what should sellers and buyers know about the market right now? Baris Akyurek is Vice President of Insights and Intelligence at AutoTrader.ca. He's joining us. We're taking your calls as well. Are you considering buying or selling a vehicle right now? Is it a good time to look at a used car perhaps? And what's your practical advice? You can call us 1-800-825-5950, 604-669-3733. You can also hit pound 690 on your cell phone. Our email is bctoday@cbc.ca, or leave a comment on our TikTok Live. And Baris Akyurek joins me now from Toronto. Good afternoon. Thanks so much for being with us.
Thanks for having me, Michelle.
What are you seeing when it comes to sales and in these last couple of months?
Yeah, sales have been pretty strong, especially since the beginning of March, both for new and used vehicles. The year started off pretty strongly before the tariff news got more serious, and February was a bit off. The weather was a bit iffy. I don't know if you remember, but we had in Ontario and Quebec, there was quite a few storms. Cold weather, and then there was a lot of question marks around whether these tariffs would be implemented or not. So It was a bit off month, and then starting March, the market has been pretty strong for new and used vehicles.
Did you see, though, Stats Canada did report that retail sales were slowing, and part of that was because of the new motor and parts dealerships and the impact there. Have you seen that slow down?
So it's slowed down tiny little bit. To be perfectly honest and transparent here, I don't really buy into the headline of things are slowing down. I mean, it's slowed down slightly compared to March and April,
Right.
sure, but on a year-over-year basis, even compared to 2019, the last normal year, so to speak, new car sales have been pretty strong. So I don't fully agree with that assessment.
Okay, so in light of that, what Stats Canada has been saying, though, there has been an increase, or at least a kind of an acceleration of used car sales. Is that something you're seeing?
Yes, and we knew that that was going to happen. Not to sound arrogant, but two things. Number one, if you remember COVID, the beginning of COVID years, 2020, 2021, 2022 specifically, it was different dynamics at the time because of the supply chain
Right.
disruption and microchip shortages, but fewer new cars were produced and sold. So some of these consumers who couldn't find new vehicles, they moved over to the used side. So this time around, the dynamic, as I said, is a bit different. But on the other hand, we were expecting this. Why? Because there was a lot of chatter around the potential increase in new car prices.
Right.
And when we went to the consumers and we did this research and we asked them, okay, so is it going to affect you? And then almost half of them said that yes, there's going to be some sort of impact on my vehicle purchase decision because of these tariffs. And then one of the top responses were that they would be switching from new to used vehicles. So we were expecting that. And that's exactly what's been happening. So as I said, since the beginning of March, the used car market is pretty hot.
What has that meant for prices then?
Yeah, so in order to be able to answer that question, I need to give a little bit more context. So demand is only one part of the equation, which is on the up, as we've talked about, but also looking at the supply side of things, especially for used vehicles, supply has been constrained. And why is that? Again, going back to COVID, as I mentioned, we estimated that 1.5 million fewer new cars were sold between 2020 and 2023. So these cars are obviously not coming back to the used car market for obvious reasons. And therefore, the supply has been on the lower side with the increase in demand. Prices are just a manifestation of these market dynamics. So therefore, we have been seeing a bit of an uptick in used car prices. So usually what happens with the used car prices is that they start on the higher side and they come down throughout the year. And that was the case until the end of February. At which time we saw a 0.5% month-over-month decline. And then starting March, prices have been increasing. So looking at prices for June, we are seeing the average price of a used car in Canada now is $37,664, which is a 3.6% year-over-year increase.
Wow. What does that tell you?
That tells me that the prices are increasing based on what's happening in the market.
Yeah. So what should, if I'm someone thinking about a used car right now, what should I consider then?
I think a lot of people who are in your shoes or people who are thinking of buying used cars, they are in the market because of these price increases. So as I always say, if you have the financial means, definitely don't wait for too long because we don't expect to see these dynamics to change substantially time soon.
Expect it to just keep going up. So what about if you're thinking about selling a vehicle then?
Yeah, same advice. I think, as I said, the market is pretty strong right now. There's a lot of activity. So if you're thinking about selling your car, it is definitely the right time to sell as well.
Okay, let me put out the numbers once again. Baris Akyurek is Vice President of Insights and Intelligence at AutoTrader.ca. They have been doing some research on vehicle sales. and seeing that they do remain strong. So wondering if you're someone who's on the hunt for a new or used car right now, do you think it's a good time to be looking at a new car? What is your practical advice? Let us know. What are you seeing out there? 1-800-825-5950. 604-669-3733. Our email is bctoday@cbc.ca. And Baris, what about specifically electric vehicles? What are you seeing there?
Yeah, electric vehicle market is very different. And what do I mean by that? So we have an annual EV research that we run at the end of March, beginning of April. It's a pretty comprehensive one. Our goal is to understand why consumers want to buy, whether they would buy one, why wouldn't they want to buy one. Like, we ask a bunch of questions to understand these dynamics. And one of the key questions that we ask in this survey is that whether they would consider buying an EV as their next purchase. So going back to 2020, when we first ran it, this was 68%. And then came down to 56% and came down to 46% the following year. And now, as of 2025, we are sitting at 42%. So the intention to buy an EV has been on the decline. But on the other side, when you think about the supply side of things, because of the mandates that we have, OEMs, automotive manufacturers, they keep producing more and more EVs. Again, you know how we analyze looking at the supply and demand. If we do the same thing for EVs, high supply, lower demand, and what happens to the prices? Prices are coming down. So looking at the used BEV prices, being battery electric vehicle prices, on AutoTrader.ca, the average price of an EV was $44,077. Which is a minus 7.9% on a year-over-year basis. And the same situation, it's similar on the new side. The average price of a new BEV was $66,891, and it is a 9.9% annual decline.
Okay, so that is kind of an opposite trend, isn't it?
Exactly.
Would you say then that that's something people should be considering now then?
Yeah, definitely. And that's exactly what's happening as well. So the uptick that I mentioned to you for the used market, that we are seeing similar trends for EVs as well. Prices started to tick up a little bit on a month-over-month basis, but they're still below last year's levels.
Okay. We have a caller, William, on the line now from Port Hardy. Hi, William.
Yeah, I said to my wife this morning, I drove it to work. Our Volkswagen is 90 years old this year, but we have only 80,000 kilometers on it. But nevertheless, it looks like it's getting to be old. But I am 70 days short of 95. She will be 65 in November, so I guess it will be mostly for her. But I'm a little skeptical of these new electrical cars because of the batteries. From what I hear about the battery, when the battery explodes. So should we buy an old-fashioned car? No, with no.
Okay, so what you're thinking about a new car? Should you go for fuel combustion car or an electric vehicle? Then you're a bit worried about the batteries.
Right, yeah.
Okay.
Yeah.
Okay, William. Yeah, it's a good question. Thank you so much. Any advice you can share, Baris?
Yeah, well, it depends on how you want to drive the car, how often you drive it, how many road trips you go to. So I think it's subjective. But that said, going back to William's point about batteries, I think that's a big concern for. That's what we hear on through research as well. Not necessarily about the explosion of these batteries per se, but range anxiety is one thing, and then the cost of replacement keeps coming up, especially when we ask consumers about why they don't want to buy a used EV. Battery health and battery longevity are the top concerns. So, but on the other hand, if you're not driving much and if you're just within the city, I'm sure it would be fine. But again, I don't know, Williams.
There's also the personal preference part of it too.
Exactly.
Yeah.
Exactly.
But you're saying it just what his concerns are reflects what you've been seeing as well through your research.
Through research as well, correct.
Well, why don't do you have any general advice then? Like, what are some red flags people should watch out for if they are looking for a used car?
Red flags? Well, I mean, look, I think the biggest one thing that we keep hearing from consumers is like purchase cost is obviously it's after your house, it's probably the second biggest item that you buy.
Yeah.
And I think doing your research, understanding the market, and being able to when you find the car, you need to be able to buy it because, as I said, the market is pretty hot. So if you're in the market, if you find the right vehicle, buy it. Otherwise, it might not be there next time you look back. So that would be not necessarily a red flag per se, but that would be one of my recommendations. And we have a bunch of tools on AutoTrader.ca where you can see if the vehicle is overpriced, underpriced, great price, good price, all those transparency tools. And they're very... they get a lot of positive feedback from consumers, especially during these kind of uncertain times. So, understand the market and look for the car that you're looking for. And once you find it, buy it.
It is a big purchase, that's for sure. So a lot to consider. Baris, thank you so much for joining us. Appreciate speaking with you.
My pleasure. Cheers.
Cheers. That's Baris Akyurek, who's VP of Insights and Intelligence for AutoTrader.ca. And Randy wrote us, as a parallel to the cost of new vehicles, the cost of parts for repairs, even used parts, has risen astronomically. As well, shop rates for qualified repair shops is very high. Randy, thank you very much. Our email again, bctoday@cbc.ca.